Thank you, Mr. Chairman. Thank you for allowing me to be a part of this hearing and pose some questions. And I would feel a little bit guilty, Mr. Kreidler, if I didn't attend. I'm not on the Healthcare Committee subcommittee. I now am on Human Resources and Trade. But I think as a fellow Washingtonian, I wanted to be here along with Jim McDermott and yourself. So thank you for coming. Thank all of you for your testimony. And I know you're proud of the product, and I know you've put a lot of hard work into the Washington State exchange system. But I just want to be here to bring a little bit of reality to it. And I think you've touched on some of those things, but I want to highlight some of the issues that we've had. But, you know, my good friend from New Jersey has said, look, you know, we're looking for this to work. And what we want, though, really, is quality health care, affordable health care. We want access, and we want the freedom to choose. And I think that in the Obamacare plan, which we oppose because it hasn't lived up to any of those promises, in our opinion. That's why we're working to correct this, because these are the things we should all be, it's not just about making the law work. These are the things that we should be after, right, for our constituents. So I know you're proud of your work and proud of the fact that over 176,000 people have enrolled in the Washington Exchange program, but out of those 176, 158,000 of those are Medicaid enrollees. 18,000, only 18,000 are individual enrollees. And isn't it true that if that number doesn't go up by 2015, that the health insurance providers will have to increase their premiums for the losses that they are going to incur if they don't get those individual enrollments up?
It is an ongoing concern, because we obviously want to get as many people enrolled through qualified health plans through the exchange, people who will be eligible for subsidies, and some that are not eligible for subsidies, but also signing up for plans.
Isn't it true, though, sir, that premiums will probably go up if those numbers don't rise?
You know, as Mr. Carson's pointed out,
yes?
as an actuary, the answer is it's too early to say, because you're only going to have about a quarter of a year in order to make those determinations. There's a lot of other pressures that apply, such as market share and competition, that are going to drive insurance companies that help to hold down the rates.
I agree that there's some time yet, but it looks like from the information that we've been able to gather, the premiums will go up if those enrollments don't go up. The other issue is the 8,000 people who had a subsidy issue. They enrolled in programs, discovered that their subsidies were incorrectly calculated. I think you're trying to address that problem, but once they now have discovered that their subsidies are less than what they supposed in the first place, now their premiums go up, and they have insurance plans that they didn't want or doesn't provide the service that they need. I think that's a huge issue. 8,000 people, you talked a little bit earlier about glitches. Glitches mean people to me. That's 8,000 people that are in a glitch that needs to be fixed. 290,000 people in Washington State received notices that their insurance plans were canceled. 290,000 people in this glitch. The President said after he made these promises, you can keep your health care plan, which was really not totally truthful, finally came out and said you can keep your health care plan. The House of Representatives here in the United States Congress passed a law that said you can keep your health care plan. Harry Reid did not bring that bill to the Senate floor. You decided, sir, to separate yourself from the President on that request and decided not to allow those 290,000 people to keep their health insurance. Did you speak to any of those health insurance carriers to see whether or not they could continue their coverage before you made that decision for those 290,000?
The answer to that, Congressman, is no, I did not.
Why not?
I regulate.
Why did you not contact those insurance companies?
We had a statement from the American Health Insurance Plans, that AHIP, that was very clear that they were distressed by. The irony of it is they were distressed about what the President proposed, but they privately would have said that the Upton measure that passed here
Well,
last
before
week
my
would have
time
been
runs
much
out,
more
before my
catastrophic.
time runs out, Mr. Cardler, I want to make a couple more points. Soon to hit now will be the employer mandate, or the employer small businesses association plans. They're going to get their notices for cancellations. I know that some already have. The other thing that really bothers me is this narrowing network issue that you spoke of earlier in your testimony. Look, we have plans in there. Only one insurance company covers the Cancer Alliance, Children's Hospital,
time has
University
expired.
of Washington's Hospital. Thank you, Mr. Chairman.
No, thank you, Mr. Reichert. First, let me recognize Dr. McDermott for a unanimous consent request.